9 News mental health expert Dr. Sheryl Ziegler joins us now for this week's Mental Health and Me. We want to talk to you about this a little bit. Dr. Ziegler, you look at Cheslie Kryst, she was highly accomplished. She also had her law degree. I mean, she had everything when you think about having everything. But she also talked about mental health and how difficult it was. So what can we learn from her death?
Well, I think the first thing that maybe the whole country's really waking up to is that suicide can happen to anybody. It doesn't matter color of your skin, your age. None of those factors really matter when you have mental health issues, maybe depression, maybe even a prior history of a suicide attempt or just really dark moments in your life. It certainly doesn't discriminate. So I think that one of the things that we can get out of this incredible tragedy is just the notion that nobody is immune to this.
Kim just talked about seemingly having everything, that external image that you may think you know your friends even so well. So talk a little bit about checking in on people that you know and making sure that you know well enough in case they may be struggling with something that you don't see or feel unless you probe.
I think it's a really important point that suicide is one of those topics that we're really uncomfortable talking about. We're scared to talk about it with our children. We think maybe we'll give them ideas, or we might be scared to ask a friend or a family member because we may think they would be offended. But what the research really shows around this is that it can be helpful, and it's not something that gives people ideas. So by simply saying to someone, "Are you really okay? It's okay not to be okay. I'd like to come over. Let's spend some time together." One of the things for me as a mental health treatment provider is there's really needs to be this installation of hope, keeping somebody looking forward and looking forward to something. So it's really important that we get comfortable around destigmatizing the conversations around depression and suicide.
I think in the past she had also mentioned cyberbullying too, and how difficult it was. I mean, she was somebody high profile, and everybody thinks they have a voice when they're anonymous. So is that another good opportunity to maybe get people talking about that and just bring it up that way, and then also discuss suicide?
I think so, and especially, even though she wasn't a child, but especially this is something that plagues teenagers and young adults, where they live so much of their lives online. And sometimes, especially if it's a celebrity, you think what you say doesn't matter, or they're too big for that, but you just put out negativity. And I think one of the things this story, I know this is an element of the story, really brings to light is that they are human beings. No matter your notoriety or your fame or money, none of those things matter. You're still a human being, and we really need to address cyberbullying. It is the #1 cause of bullying at this point right now, and something that I think we don't really pay enough attention to, how we treat each other online.
Well, there is hope, I guess, that the notoriety of cases like Cheslie Kryst will help others think about others as well. Dr. Sheryl Ziegler, thanks again. It's always good to talk to you.
And just a reminder, there is always help for anyone who needs it. Colorado Crisis Services always has someone who can help. Just call 844-493-8255. You can also text the word TALK to 38255.